and sports medicine physician, and today I'm comparing boxing versus MMA. Which one is more dangerous? So if you're new to the channel, be sure to subscribe and hit the notification bell, and make sure that you enable all notifications so you can be notified when we post new content.
Yeah, I got it.
So if you know anything about boxing, you know that junior welterweight Maxim Dadashev died on July 23rd of 2019. Maxim, or Mad Max as he was known, was a talented fighter who had a record of 13-0 with 11 knockouts. The Russian fighter was fighting another talented fighter, Subdural Matias from Puerto Rico, who also had a 13-0 record with 13 knockouts. This fight was destined to be a history maker and a barn burner. As I mentioned, both Dadashev and Matias had previously been undefeated. Now in this fight, Matias landed 53 of 142 shots in the 11th round. Throughout the entire fight, Mad Max absorbed 319 shots, of which 266 were power shots. Now, not every single one of these shots went to the head, but he suffered many blows to the head. In between the 11th and the 12th round, Max's coach begged him to stop the fight because he felt that he was taking too many blows. And although Mad Max did not agree, his coach and trainer, Buddy McGirt, threw in the towel and called the fight anyway. After the fight was called, Mad Max required assistance to be helped from the ring. He was able to walk, but was experiencing great difficulty in doing so. And when we look at the video following the fight, we can see that he was experiencing a decreased level of consciousness and had begun vomiting before he was sent to the hospital. Upon arrival at the hospital, his level of consciousness had become quite obtunded, or quite decreased, and he was subsequently taken to the operating room where he underwent a 5-hour operation to decompress swelling and bleeding that he had experienced on his brain. After the operation, he was sent to the ICU, where unfortunately, he succumbed to his injuries 5 days later. Maxim Dadashev died of his injuries at the age of only 28 years old. Less than a week later, on July 5th of 2019, a second professional boxer died of injuries that he suffered in the ring as well. Argentinian Hugo Santaland died in a super lightweight fight against Eduardo Javier Abreu. In this fight, Hugo died after a 10-round fight that went the full distance. This fight resulted in a draw between the combatants. After the fight, Hugo experienced difficulty standing in the ring, and we can see this in the video as his coaches had to hold him up for the announcement of the scores. After the announcement of the outcome was completed, Hugo actually lost consciousness in the ring. Hugo was taken to the hospital where he was subsequently admitted with an initial diagnosis of renal failure. However, he was taken to the operating room a short time later to undergo a cranial decompression for swelling on the brain. And although he underwent a lengthy decompression procedure, the swelling on his brain worsened nonetheless. Over the next few days, he underwent a cascade of multi-organ system failure, and eventually he succumbed to his injuries 4 days later. He eventually died of a cardiac arrest after suffering cardiorespiratory failure twice. So basically, although his primary injury was to his brain, over the course of several days, most of the organs in his body began to shut down, and eventually his heart could no longer take the stress, and his heart eventually failed. So what the heck is it that happened to these two boxers, and why did they both die? Well, boxing is a dangerous sport that involves repetitive blows to the head. And one of the injuries that can come as a result of repetitive blows is a subdural hematoma. And both of these boxers died as a result of the consequences of subdural hematoma. So what exactly is a subdural hematoma? A subdural hematoma is a collection of blood outside of the brain but inside of the skull that usually results from severe head injuries. It may also be caused by repetitive blows to the head, and the bleeding around the brain causes increased pressure on the brain itself. And this is because the sudden blows to the head are known to cause bleeding from the surface vessels on the brain. Anyone who suffers a subdural hematoma will experience a loss of consciousness, and if this is untreated, they will eventually go into a coma. If the subdural hematoma progresses at a more slow rate, the person may experience a period of confusion before the loss of consciousness occurs. Other symptoms of a subdural hematoma include headaches, dizziness, nausea and vomiting, lethargy, weakness, and seizures. Now, if the subdural hematoma is small, this is something that could potentially be monitored by medical personnel over a period of time to ensure its resolution. And this is something that will usually be done with serial monitoring by CT scan. If, on the other hand, the subdural hematoma is large, then surgery is required. And there are a number of different surgeries that can be performed depending on the severity of the subdural hematoma. The different types of surgery that can be performed include a burr hole, a craniotomy, or on rare occasions, a craniectomy. So what exactly is that? A burr hole is a procedure where a small hole is drilled into the skull and the hematoma is sucked out through the hole. If the blood clot is larger than can be evacuated through a small hole, then a craniotomy is performed. And this is where a portion of the skull is temporarily removed to gain better access to the clot. On rare occasions, when the swelling is quite severe, the flap of skull that has been removed is not replaced for an extended period of time. This is called a craniectomy. This procedure will allow expansion of the brain without injury. Typically, when any of these procedures is performed, the patient will require an extended period of life support. So what are some of the stats about boxing, and why is it that boxing causes these injuries? When we look to the literature, there are a number of studies that document the forces that are involved in boxing. One study documented that the peak punching force produced by professional boxers ranged from 447 to 1,066 pounds. Another study documented that the average force was 776 pounds, with elite fighters generating up to 1,300 pounds of peak force. WBC heavyweight fighter Frank Bruno was calculated to generate up to 1,420 pounds of peak force. 1,420 pounds of peak force is enough to cause an acceleration of 53 G. That's right, 53 times the force of freaking gravity. And if we look to the Wayne State tolerance curve for the effects of acceleration, we see that anything more than 50 G's is bad. You don't want that, because 50 G's or more is associated with a higher rate of mortality. Interestingly enough, although the sport itself is more bloody, mixed martial arts punches are known to generate less force than are boxing punches. In a study of karate black belts, fighters were shown to generate an average of 325 pounds with a peak force of 412 pounds. That's 412 versus 1,420 pounds. The study also showed that mixed martial arts fighters are at less risk of knockout during their bouts, with a risk approximately 1/2 that of boxers. And it is important to note that mixed martial arts includes many methods of contact: grappling, kicking, and tap outs by submission. In addition, in mixed martial arts, there is no standing 8 count. Furthermore, a boxing match is anywhere from 10 to 12 bouts, and they usually last 3 minutes. Whereas a mixed martial arts fight can have between 3 rounds to 5 rounds, depending on whether it is a regular or a championship bout. Each of these bouts will typically last 5 minutes, for a total duration of 15 to 25 minutes, versus a boxing match which can last from 30 to 36 minutes. Now, with both boxing and mixed martial arts, we are usually concerned with the cumulative effects of repetitive blows to the head over the long term, such as with CTE, or chronic traumatic encephalopathy. However, even over the short term, it is quite clear from these two cases and others that cumulative blows to the head over the short term can even be deadly. So how deadly do you ask? Well, let's look at some of the stats on this. If we consult the Manuel Velasquez Fatality Collection, we can see that there have been 650 deaths which can be attributed to boxing between the years of 1918 to 1997. If we extend the range from 1890 to 2007, we can see that there are 923 deaths that can be attributed to boxing. 65% of these deaths were associated with a knockout loss. Most importantly, the incidence of death decreased after 1983, when the number of rounds in the boxing match was decreased from 15 rounds to 12 rounds. The decrease in mortality was attributed to several reasons, which included a decreased exposure to repetitive blows to the head over the duration of the fight, increased medical oversight, and stricter regulations overall. The authors concluded that increased medical supervision of boxers and mandatory CT imaging of the brain after a knockout would result in a decreased overall mortality for fighters. Now, let's look at some stats for MMA fighters. In a study by Nagay et al., they looked at data from the Nevada Fighting Commission over a 5-year period between 2002 and 2007. And during this period of time, they looked at 635 fights, which involved 1,270 fight exposures. The typical injuries included lacerations and upper extremity injuries. Severe concussions occurred with an incidence of 15.4 events per 1,000 fight exposures, for an overall percentage of 3% of matches. During this study period, there were 0 deaths. Zero deaths. The authors concluded that the overall risk of critical sports-related injuries was relatively low. Another study by Lystedt et al. Reviewed 6 studies in a meta-analysis of MMA injuries. In this study, they found that the area most often injured was the head in 68 to 78% of the cases. The hand was the next most injured area at 6 to 12% of the cases. The most common injury suffered was a laceration in between 30 to 59.4% of the cases. Fractures occurred between 7 to 43% of the cases, and concussions occurred in 4 to 20.4% of the cases. Losers were injured 3 times more commonly than were winners, and if the fight ended in a KO or a TKO, then injuries were twice as common than when the fight ended with a submission. And although not reported in the research literature, Wikipedia states that there have been 16 deaths during mixed martial arts events, which include 7 deaths during sanctioned or professional bouts, and 9 deaths during unsanctioned or amateur bouts. So I've thrown a lot of numbers at you, but what does all this mumbo jumbo mean in the end? Well, although boxing and mixed martial arts have somewhat similar injury profiles, there are some profound differences. Number 1, the peak force generated in mixed martial arts punches is lower. Number 2, mixed martial arts has less critical injuries than does boxing. Number 3, there is less exposure to repetitive blows to the head in mixed martial arts than there is in boxing. And number 4, there is a decreased exposure time for injuries in mixed martial arts than there is in boxing. So, although it's more bloody, mixed martial arts appears to be a safer sport than is boxing. And although boxing is a celebrated form of entertainment, we have to remember that it is a serious combat sport, and it carries with it the risk of serious injury, including even the risk of death. So there you have it. Today I've been comparing boxing versus MMA. Which one is more dangerous? And I think we have the answer. And as always, that's been a word from Dr. Chris, not your everyday ortho.